Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I am so excited to introduce our guest today as we speak about virtual urgent cares. Ryan Hall attended Texas Southern University to pursue basketball before transferring to Lamar University to complete his bachelor's degree in nursing in 2015. In 2020, Ryan obtained his master's degree from Chamberlain University, specializing in family medicine. Being exposed to different hospital systems, diagnoses, and situations, Ryan has learned to provide excellent patient care to a diverse Houston area community that is growing incredibly. Ryan has the ability and experience to deliver positive patient outcomes under the most difficult conditions. Welcome, Ryan. We're glad to have you here today.
Thanks for having me, Miss Donna. How are you?
I'm great, and we're glad you're on our team. Because of COVID, it's like things have changed the way we deliver medicine.
Definitely.
And I think everybody's gotten so comfortable with the way we deliver that we see a lot of online visits and that kind of thing.
Right.
But today we want to talk about the virtual urgent care. What kind of issues can be addressed in a virtual urgent care?
Well, to start off, we are a family practice and we also have internal medicine members on our team. So the issues that can be addressed literally are any issues that you have. If it's an urgent issue, I can address it online. If it's something that's chronic that requires further care, we can establish the care today with a follow-up appointment the next day to get everything else finished and squared away. If it's an emergency, we'll definitely refer you to go to an emergency department. And from there, we can also continue to follow you there and, maintain and establish care. That way, when you're discharged, everything stays with us. It's with the same people and everybody has access to your records to be able to deliver care conjoint between each other.
So, Ryan, I'd assume if someone's having chest pains or they think they're having a heart attack, virtual care is not the place to be.
That's not it. No, I'll tell them that right away. But of course, we'll assess you. We won't deny you or turn you away. But if it's something that we deem is not, safe for you to wait, we will tell you to go.
But I guess for flus and coughs and maybe ear infections or...
Definitely. All of that, fevers. Now, certain things as far as out of medication, we can do those as well. Refill your meds. But when you get to controlled substances, that might require, a next day visit to kind of get a physical on you, establish a baseline and see why you need it and how we can continue from that point on.
Okay. So do I need an appointment for a virtual?
Yeah, with us, you do. We have our number listed on the flyer that we'll have posted everywhere. And you call that number, and during business hours, we'll be able to establish an appointment for you for that evening. Usually when you go to our clinics, everything is by appointment only. So if it's something that needs to be seen and you need it done right away today, we'll definitely put you on a schedule to be seen that evening. And it's very beneficial for parents that, work 8 to 5, 8 to 6, that may come home a little later, they have kids, something simple that maybe not requires an ER visit. And, with the wait, that's something that they can be able to schedule while at work. And then when they get home, be able to do the appointment.
Great. So who's eligible for the virtual visit? What ages?
Any age. Yeah, we allow, we're able to see infants. If the parent is pretty positive that, hey, my baby, I'm sure she has an ear infection or pink eye, we can do prescriptions like that without having to physically see, the patient face to face. But yeah, any age.
And now the virtual visits are face to face virtually, though.
Technically, yes. But,
yes.
A lot of patients
no touching. Okay. So does insurance cover these visits?
Insurance does cover these visits, especially with COVID happening. A lot of insurance companies have now taken the initiative to incorporate that in most plans. So my best bet for you or for any patient that's wanting to find that out is to give their insurance company a call. And if they can't, they can call us, give us information off their card, and we can verify for them.
So, will my primary care receive a copy of my visit?
Yeah, definitely. Like I said in the beginning, we are part of the primary care group. So any patient that sees me, and if you're within our hospital system, it's automatic that they're going to see it. And if you're with another system, but you're visiting with us today for a telehealth visit, we can definitely have your records sent to you or available for you to pick up to be able to take and bring to your own primary care physician.
Great. So, Ryan,
Yes,
do
ma'am.
you think remote care is good or virtual care?
Well, there is a difference. Technically, there is a difference. Remote care is using the most up-to-date technology to monitor you, from far away, like a wearable medical device, something that you can attach to your body to monitor heart rate. There's somebody always monitoring that. Versus a virtual care is more so an urgent issue, me providing care immediately, but I'm not able to physically monitor or do certain things like remote care.
So, is virtual visits safe and secure? It's HIPAA compliant.
Definitely HIPAA compliant. We're on a secure server. Hacking, I know a lot of that's been going on lately, but with this company, Oak Bend, and the service that we're using, they use and make safety a number one priority by having HIPAA guidelines, making sure that information is safe and secured within their system and servers.
Okay. If I require a prescription, can I get it during my virtual visit?
Definitely. All prescriptions can be obtained definitely through me. We will, speak about the reason why you need the medication. And if it's something that requires you to come to the office, I will let you know. Just as an example, a young female may have a certain issue going on and she wants medication, but first we need a pregnancy test to eliminate that. That's an issue where I couldn't just right away give you the prescription. So that's where the appointment will come into play. And those things will get taken care of immediately.
So, with the flu coming up and we still see COVID and those kind of things, what are your suggestions for that? Well, people are scared. Do I have COVID? Oh, my goodness.
Definitely. And when COVID just started, that was an issue as well. People had symptoms. They came in thinking maybe strep throat or flu. We do the test and they're negative, and it's like, oh, well, if it gets any worse, you might have to go to the ER to get evaluated. So same thing applies. Since then, there's vaccines now. There's mask mandates here or there. So I encourage everybody to wear their mask if they're out in public or in large groups. Or large groups or small enclosures. Wear your mask. If you're free by yourself, no problem, take it off. Use your discretion. And if it's feasible and possible, personally, get the vaccine. It'll help you, number one, from ending up in the hospital, and number two, it'll prevent certain serious illnesses or complications that develop if you were to contract it and have other comorbidities, lung issues, high blood pressure, stuff like that. So definitely vaccine and mask up.
So what about strains and sprains and those kind of things?
Well, technically we can always order x-rays. You might not be able to get it immediately because you would have to go to an office tomorrow or that same day, depending on the time that the encounter may have happened. But we can definitely give you medication, pain medication, small, light doses. We'll give you recommendations as far as how to care for the injury without medication. And definitely we'll have orders in place for you to get those, those injuries looked at.
So, Ryan, I heard something about you.
Uh-oh.
And Ryan's real worried about what I'm about to say.
No, just a little.
No, I heard that you have emergency room experience.
Yeah,
and critical care.
Mm-hmm. Yeah, I've been in the ER literally 10 months as a nurse. As I was 10 months into the job, I transferred to the ER department, and I've been there from 2017 all the way to 2021.
Okay, and I want people to understand that you're just not out there. You do have the experience of emergency care.
Definitely. I've been a travel nurse. I went to many different hospitals within Houston as far as their ER, working as a floater or a PRN emergency nurse for different hospitals that are short-staffed. So number one, There's patients everywhere. There's a lot going on, and we're very short-staffed. Yet, I am there to get that experience, serve these patients, and create better outcomes to help, make the workflow a lot better. So being at these different places, I've seen a lot, I've encountered a lot, and, you've met a lot of doctors and met a lot of people that were willing to teach along the way and give you that experience that made me want to become a nurse practitioner, because I knew I could do more than what I was doing inside the ER as a nurse.
Well, Ryan has been great since he started with Oak Bend. We were even out at Lamar CISD teaching nurses how to do COVID testing.
Definitely.
So he is very good at his job, and we're very happy to have him. Ryan, I also understand, or you may not even know, Oak Bend has its own remote equipment too.
I heard that we might be dusting those off and putting them to work soon.
I agree with you. And so that there will be more to come there. We will be posting Ryan's information on how to get in touch with him and what we can do. You don't have to be a medical group patient in order to see Ryan. Ryan's here for everybody, if he can treat you. So we will be sending all this information out and more to come. Ryan, do you have anything you want to tell our audience?
I just like to say, I am a New Yorker, but I've been living here in Missouri City, Fort Bend area for over 20 years. So I consider this home. I consider Fort Bend, the Richmond area. I live in Missouri City. That's my stomping ground. And these are the areas that I am proud to be able to come back and serve. And, this is where I grew up. So I'm happy to be here. I'm happy to be a part of the team, and I look forward to meeting the community.
Well, we're going to adopt you as a Texan. How about that?
Fair enough.
Okay. Well, Ryan, I want to thank you for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.